Another question I got asked is why there's so many kinds of acne treatments. We've got facials, we've got topicals, over-the-counter drugs, doctor drugs, treatments. Why so many? Acne is a spectrum of disease. It could be mild, it could be severe, it could not scar, it could scar, it could be just a few pimples during puberty and it's hormonal and then you grow out of it, or you never grow out of it and it gets worse. Because it's such a wide spectrum of disease, we have a lot of treatments. Now, the biggest problem with acne is scarring. So if you don't scar, then it's a temporary inconvenience. If you scar, then it's a permanent disfiguring of the skin and you want to treat it. So treating acne early and aggressively if you're scarring is important. Why so many treatments? Because mild acne during puberty doesn't scar, heals very well with over-the-counter topicals and facials. And if this works for you, stay with it. But if it doesn't clear and you get scarring, quickly see a doctor because it is a skin infection. Remember this, pimples are plenty of little infections on the face that can cause scarring. Just like you have an infection on your little toe or your finger, run to see a doctor because it's an infection. We treat infections. How aggressively do we want to treat infections? Depends on how bad your scarring can be. If it's really bad scarring, aggressive tablets, energy-based devices, topicals, everything, throw everything at it because the earlier we can treat it, the less the scarring is. If it's a little bit of infection, we can control with topical antibiotic. We have that too. So it's a spectrum, depends on the patient, depends on the degree of scarring, and so we have to titrate according to what your response is and what your future problems can be.